and the best way, oh, so that's going to pop up. You can just hit got it and that big white box will disappear. You can put your questions in the chat box, and the chat box is at the bottom of your screen. If you scroll your mouse down, a little menu bar will pop up, and in the middle, you'll see chat. If you click on that, on the right-hand side of your screen, a little chat box will pop up. You can type your question in there. I'm going to read them all, and I'll read them out to the presenter. That's what we do to sort of avoid double questions or things taking too long. So I encourage you to ask any questions that you have. Some of them may be answered later on in the presentation. There you go. Ruth has popped a question in just so you can see how that works. So without further ado, I'm going to introduce our first round of speakers. We're very lucky. So for those of you who have forgotten what you're joining for, we're going to be going over the what I call our most optimistic webinar of the year, the travel webinar. Yay, traveling during COVID, but really with a focus on insurance, what you need to keep in mind. Certainly the last couple of weeks, things are changing by the hour. We were just having a quick discussion before everybody came on the fact that the Canadian government is changing things again. The Quebec government are having a press conference today about booster shots with the new variant. There's a lot of concerns, but people are still traveling. So this information is relevant and important. I recommend you to get a pen and paper to take whatever notes. We have two speakers to speak first, who are going to cover all the information around travel and insurance. And then we have a bonus topic later on, starting at around 11:30-ish, provided that we're on time. And that's going to be reviewing some different important information about real estate and owning real estate abroad. It's a topic that's of interest to many people who travel often in the winter, snowbirds, somebody who is thinking about buying real estate in another country to be able to get out of here in the winter. If you can, do it. So our first guest speakers are going to be Stephen Fine and Jason Nagy. And so Stephen is the president and founder of Snowbird Advisor and the president and co-founder of Snowbird Advisor Insurance. I've got a great bio here. I'm going to try and go through it quickly, but he's driven by his passion for travel and tourism. Stephen founded Cross Border Media in 2007 as a boutique travel media company where he developed a number of successful online publications and resources. In 2016, he launched Snowbird Advisor, which quickly became a leading one-stop resource for Canadian snowbirds. In 2018, Stephen co-founded Snowbird Advisor Insurance to assist Canadian snowbirds, boomers and seniors with their unique travel insurance needs. Stephen currently sits on the board of directors for Discover America Canada and the Travel Health Insurance Association of Canada's Innovation Committee. That's a name. Stephen received his BA from McGill and his law degree from the University of Western Ontario and served as legal counsel and executive roles for multiple media and software companies. So welcome, Stephen. And joining Stephen to discuss different aspects of this is going to be Jason, who's the director of operations at Can-Am Insurance and Snowbird Advisor Insurance, the travel division. He joined Can-Am as the Director of Operations in 2016 and Snowbird Advisor Insurance in 2018. He's worked in the insurance industry in various roles for 12 years with a focus on the customer journey. He's got boundless enthusiasm for driving efficiencies and new ways to deliver insurance solutions to the travel insurance market. So I think these are some very well-placed people to give us some advice on this ever-changing and super important topic. Stephen and Jason, I turn it over to you. Thanks, everybody.
Thank you, Vanessa. I really appreciate the introduction. I realize I have to cut down on my bio in the future to make it a little bit shorter. And thank you, everybody, for joining us today. And Jason, thank you for joining us. I mean, we both know our insurance, but Jason is the real expert. So we're going to have a bit of a back and forth here with a bunch of different questions, cover a bunch of different topics. But I'm going to have Jason cover most of the material because he deals with it on a day in and day out basis. And the goal here as well is really to educate you regardless of where you go to get your insurance about what you need to look for, the pitfalls, the questions you need to ask, whether it's from us, whether it's from somebody else, it's all relevant. And again, some of it can be a little bit overwhelming. In the slides, you will notice that we do have links to in-depth articles on our website. So don't feel the need to take notes or you're going to miss anything. I would listen to Jason, and you're going to be provided with a copy of the presentation afterwards. If there's any topic that you want more information about, you can just go to the slide and click on the link, and it will send you to a more in-depth article on our website that will provide you with more information. So don't worry about that. And I guess on that note, if we can flip over to the presentation so we can start covering ground on that, that would be great.
And Stephen can keep me honest for time, as I will talk about travel insurance till I'm blue in the face. So
I'm going to try not to cut you off, Jason, but if I have to at some point, you know, Jason and I were joking about this yesterday when we were talking about the presentation. This could be a 3-hour presentation, but I know everybody's eyes would glaze over if we went into all the details. So we're going to cover the broad strokes here, what you need to know. And again, there are articles and resources, so you can take a look on our website afterwards. And of course, there's a Q&A. And if you do have any questions, you can also call or email us afterwards. So if we can go to the next slide, that would be great. So I'll give you a brief overview first about Snowbird Advisor and Snowbird Advisor Insurance. So Snowbird Advisor is a one-stop resource for Canadian snowbirds. We provide tips, news, guides, articles, tools, services, and more for snowbirds. We cover a variety of topics like travel, destinations, accommodations, RVs, real estate, insurance, health, tax, legal, finances, and more. And we have free memberships available on our website. So if you're interested in getting our newsletter or becoming a member, it's free to sign up. You can just visit our website and sign up there. And if you want to move on to the next slide, please. Great. And Snowbird Advisor Insurance, as Vanessa mentioned before, we specialize in providing Canadian snowbirds, boomers, and seniors with travel insurance to meet their unique needs. Our agents, combine coverage options to ensure you get the right coverage at the most cost-effective price. And as I mentioned before, the way we differentiate ourselves from other people is we really like to educate our clients. We're not just out there to sell insurance. We want you to know the pitfalls and make smart choices, regardless of whether you get your insurance from us or from someone else. And that's what we're going to cover mostly today. And one of the policies that we do offer is very helpful for a lot of seniors and boomers. It's a personalized travel policy that has no stability period for pre-existing medical conditions, but we'll get into that a little bit later as we talk through insurance. So if we want to get going on that and move to the next slide, we're going to start with 2 sections here today. The first section is going to be general travel insurance tips and information, and the second section is going to cover some specific COVID travel insurance questions that a number of people are having these days, because it's obviously very topical with everything that's going on. So if we can start with the first slide. So first thing we're going to do is start from the beginning and go with what's covered. What does travel insurance cover? What types of policies are available? So Jason, if you want to hop in and explain the 2 different primary types of travel insurance that exist.
Yeah, so I mean, you can see on the slide that there's the emergency medical coverage and your trip cancellation and interruption. So the difference there is your emergency medical is to protect you for the sudden and unforeseen medical costs that occur while traveling, and your trip cancellation and interruption are to cover you for your non-refundable expenses for events, travel requirements, basically out of money expenses that you can't get refunded. And so it's, if you have a hotel, if it's been over 24 hours and you lose the whole booking, it would reimburse you for things like that. The key with the travel medical, and we'll go through this a lot in this presentation, but just to kind of nail down, is that it is for the sudden and unforeseen emergency medical. So we'll talk about pre-existing conditions as well as stability periods to kind of drive that point home, but it does not cover elective. That's the biggest thing to remember. We have some products that don't have stability period, so you can go down after just having a procedure. It'll cover any additional complications, but it wouldn't cover any follow-up or routine, because again, it's still that emergency medical coverage. So those are the 2 types of travel insurance that are out there today.
Yeah, so I guess the way to summarize it is the travel medical insurance covers you for medical issues, and the trip cancellation covers you for out-of-pocket travel expenses like airline tickets, cruises, tours, hotels, vacation rentals, things along those lines. And now if we can move on to the next slide. So there are a few different types of travel insurance plans, and Jason's going to go through those and explain the differences to you.
Yep. So the single trip and multi-trip plans work for both medical and trip cancellation, depends on how they're packaged. However, when you're looking at I guess, what's best for you, multi-trip plans are where we start if you're going to be traveling more than 2 periods in the span of a year. And so you can purchase them in small periods from 4 days. So that's if you're just someone who enjoys the weekend hops or even just daily shopping. It's the smallest package they go. And that's typically if you're in a border city. I mean, I'm in Windsor, Ontario. I used to, before the pandemic, hop across weekly to the US. It was nice and easy. But they can go as high as 30 days to 60 days. So it's if you're traveling typically more than twice a year, you're going to find them to be your best cost. And there, as many times as you want to take them up to the maximum, as many times as you want to travel and leave the country, you get those days up to the maximum that you've purchased, and it resets every time you return. So if you come back to Quebec, it resets. If you have a 30-day, you can leave for another 30 days. Single trip plans are where you're just purchasing for a specific amount of time. So that can be for 1 day all the way up to 365 days with some further added criteria we will also cover. You will also find that we will use a multi-trip annual plan if you're someone who's multiple traveling, and we will use those top-ups and extensions to make sure that you're covered for the whole way. So an example of that is top-ups and extensions are pretty ubiquitous. They kind of mean the same thing. Top-ups are when you're looking for an additional coverage, be that more money or longer travel. And extensions are where you have an existing travel and you're looking to extend it. So an example of what you can see is you might have a 30-day annual plan and you're traveling to Florida for 120 days. You'll get that 30-day annual plan because you may have some other trips, visit the kids in the US or wherever they may be, but you will cover, top up that annual plan with a 90-day single trip plan to cover that full 120 days. But because you're only paying for 90 days as opposed to 120, you can save some money. An extension, just to clarify, is as long as you're still have valid coverage while you're traveling and you're looking to extend that trip, you just have to make sure that you're purchasing it prior to the expiration of your current medical policy.
And just to add to that, Jason, the single trip and multi-trip, your original plans need to be purchased while you're still in Canada before you leave the country. And your top-ups and extensions can be purchased while you're out of the country, as long as your original multi-trip or single trip plan hasn't expired yet. So you're going to want to be aware of that, because we do get calls sometimes from people who are already overseas saying, hey, can I buy travel insurance? And unfortunately, we can't do it because you need to be in Canada before you purchase your original policy.
Correct.
And if we can go on to the next slide. Okay, so this is an important, very important point for everybody to remember. Disclosure requirements, both when you're purchasing your insurance and your ongoing disclosure requirements to your insurance provider. Now, the number one reason why claims are denied in the travel insurance industry is non-disclosure or misrepresentation of medical conditions. So this is something you're going to want to be aware of both the purchasing stage as well as after you've purchased and before you've left for your trip. So I'm going to let Jason take that away.
Yeah, so this is, I guess the owner's point of every application is when you have to answer the questions. And so on average, the emergency medical policies, if you have a questionnaire, you're looking at 20 to 50 questions that are yes or no, and they can be broad and they can be at the same time confusing. So they'll always ask you questions like, have you had a heart condition in the last 2 years? And then 20 questions later they'll ask you, well, have you had a heart condition in 5 years? And so the goal there is they're just trying to identify where you would fit in the risk categories, but that's where people can get caught up and perhaps provide the wrong answer. And so it's very important as you're going through the questionnaire that if you aren't 100% sure of your medical conditions, that you speak to your medical professional. In the insurance industry, we can always find it fascinating. People can tell us exactly when they last repaired their car or had their oil change, but when you start talking about your personal medical, it can be overwhelming. Doctors use very technical terms. We in the medical insurance industry use technical terms, and so it can be a little overwhelming. And so it's just important that if there's anything you are hazy on or confused or not 100% positive, that you speak to your medical professional so that when you're answering these questions, you can answer accurately. The big thing, though, that catches people off guard is the ongoing disclosure requirements. And so in emergency medical travel insurance, if you a lot of snowbirds particularly will book their plans months in advance. You'll know where you're going. You'll have your rentals determined, or you own property and you're just looking for your travel accommodations, and you'll buy your travel insurance, a month or two in advance. The part that needs to be remembered is that if something changes in your health between when you purchase and when you depart, you do need to update that emergency medical plan. It's not a snapshot of when you purchase. It is considered the medical condition you're in at time of departure. So if it's changed between time of purchase and time of departure, you do need to make sure that you've called your travel insurance provider and updated that information.
And also, when we talk about changes to your medical condition, Jason, any changes can mean any changes. And that's really, it can apply to things that you generally might not think about. For example, we've listed a few of them here. Increases and decreases of medication dosage, starting or stopping a medication, having a diagnostic test for potential new medical conditions, even if those conditions aren't yet diagnosed. So you need to be aware of all of these things, and I'll let Jason expand on that a little bit more.
Yeah, and some of that's where they come up with the stability period, which we're gonna go over. And stability is where we get the most questions, I guess, in the brokerage.
Okay, great. And if we can go on to the next slide as well. Now, here are the consequences Jason will go over if there is non-disclosure or misrepresentation of medical conditions.
Yeah, best case scenario, they'll find and just exclude you from the conditions that weren't disclosed. So if you have an unrelated medical claim, that they'll cover that and then censor you for the other coverage. However, they're well within their right with the way the policies are worded that they'll just void the whole policy. And so we all hear those stories when there's a claim that around something unrelated, but the whole policy is voided. And that is simply because on one of the requirements of the application is its accuracy and honesty in the disclosure of information. So this is why I say if you're hazy or have any uncertainty about your answers, it's very important. And you just go to your general practitioner, your doctor, your family doctor, they will have access to all of your medical records, even if they're not the ones who provided the care or testing. They will be able to help you with this. They usually do charge a fee. However, you can get them to just give you your records, and then that way you have them when you're looking to apply. So very important.
And if we can move on to the next slide. Thank you, Jason. So here's another thing we're gonna go over this quickly: eligibility, exclusion, and coverage limit clauses. So eligibility, what some people don't know is there are certain criteria you need to even be eligible to purchase travel insurance. So one is being a Canadian resident. Another one is having coverage under your government's health insurance plan. So you need to be covered by your Quebec plan, Ontario plan, depending where you're a resident. In some cases, there's an age limit to be eligible. And in addition, some serious medical conditions make you ineligible for coverage. Some examples of that are metastatic cancer, terminal illnesses, or an illness where your physician has advised you not to travel. So some things will make you ineligible for travel insurance if you don't meet the criteria. Then, sorry, Jason, go ahead.
I just want to point out that especially with the Snowbird population, you need to make sure that that provincial healthcare plan is in place. So if you're traveling beyond 183 days outside of Quebec, you do need to get the, sorry, Stephen, we actually cover this later. The MQ needs to provide an extension for you because it is very important.
We will go into details on that and provide you with what you need to be aware of in Quebec in terms of maintaining your provincial health insurance coverage, because it's very important for a lot of reasons, but it does relate to travel insurance as well. And then there's also the exclusions here. So, policies will exclude certain expenses or conditions from coverage. It varies from provider to provider. And if we can look at the next page here as well. So exclusions, Jason, if you want to touch on exclusions a little bit more.
Yeah, so the unstable conditions, we'll talk about stability period a lot coming up. Failure to provide truthful and accurate, that's that non-disclosure that Stephen and we were talking about. Some other things, though, that you need to be aware of are anything that's kind of intentional or seeking involuntary treatment will not be covered. Not contacting the assistance center is another big one. So it's very important that you contact your insurance provider prior to seeking treatment to make sure that it's approved. Anything where you're doing a certain activities. So we're talking high risk activities, and they're usually listed near the end of the exclusions. And so there are things like mountain climbing without certain proper equipment. So they list the different, and it depends on your provider. Some will cover all mountain climbing, but some other things that we like to basically, we'll read it to you if you're purchasing one of our policies. However, rule of thumb, if you're signing a waiver for it, you're probably not going to be covered from any injuries as a result of it.
And in terms of informing your insurance provider before you seek treatment, that's the general rule. But of course, we'll go into this a little bit later. But if it's an emergency, you're having a heart attack, you're in a serious car accident, you just go get treatment first and then deal with the insurance company afterwards. So we'll cover that a little bit more later when we'll talk about making a claim. And then, Jason, did you
the one thing I just want to mention, the one thing I just wanted to mention is the last point: expenses not related to emergency medical treatment. So that's your diagnostic treatment. There will be times, obviously, doctors will need to send you for a test to find out why you're experiencing symptoms or what's wrong. That's not what we're referring to when we say not related to the medical emergency. This is where if you have something that is potentially you have an existing medical condition and their levels might be off, and you might just be like, well, I need to go get this checked. Typically, that's not going to be covered under the plan. If you're experiencing acute symptoms, then it could be. It's one of the largest gray areas of emergency medical travel insurance. So what I always recommend is if you're ever in doubt, just call the assistance center. They'll be able to advise you prior to you seeing a doctor so you know if you're going to be covered out of pocket or not.
So Jason, would an example of that be if someone needs blood work on a regular basis and it's from a condition they had before they traveled, and just to go get their blood checked, that would not be covered under an emergency medical policy, right?
Perfect example, yes.
Okay. So that's a good example. And then claim limits also. Policies have claim limits on them. They might have claim limits for specific treatments. There may be caps or certain types of expenses that are covered. And every policy will also have an overall coverage limit. So common coverage limits are $2 million, $5 million, or $10 million. And the policies that we have are $5 million and $10 million in terms of their coverage. But you're going to want to know what you're covered for in terms of your cap, because sometimes medical expenses, depending on the issue, can get quite expensive. So something you're going to want for peace of mind.
Yep. It is important, though, to check those special limits, as there are some that will provide like a maximum of dental emergency care will be at $1,200 or $2,500, depending on the policy. So it is important to know if they've capped any of those special cases. Make sure when you're comparing apples to apples that they're included.
Yeah. And if we can move on to the next slide, that would be great. Now, pre-existing medical conditions. I'm going to let Jason take this one away, and we'll explain what they are. We touched on them earlier, but it's important to be aware of what they are.
So pre-existing medical condition is a very broad set of conditions. Basically, if you've been diagnosed with, treated for, or received medication for anything prior to leaving, it's a pre-existing medical condition. Typically, these are more major than what we call minor ailments. Minor ailments are things that you and I would just call like the common cold, your a week of flu or whatever. Short-term issues. However, one of the questions we get a lot, and this happens in a lot of the medical questionnaires, is I'll use an example, very generic, about high blood pressure. Every questionnaire we have that I've ever seen in the industry will always ask at some point, are you taking any medication for hypertension, high blood pressure? And we will often get the comment, no, I take medication. That doctor says I don't have high blood pressure. And so the clarification to understand that is, you're taking medication for a condition. That condition is high blood pressure. The medication may alleviate the symptoms and remove it from being a concern, but you are treating it with medication. So it's important to understand that if you're taking anything to address a concern that brings you back to optimal health, we would, in our industry of the medical travel insurance, you have that condition and it needs to be rated for. Yeah, however, there can be.
Sorry, go ahead.
Good.
And if we can move on to the next slide, actually, that would be.
It's probably where the next area I was going. Yes.
So pre-existing conditions. So how do pre-existing conditions affect your coverage? What are the implications of pre-existing conditions? So Jason, you can go over this one as well.
Yeah, the biggest point that everyone cares about is that it does affect the premium. So standard travel insurance plans lump you into buckets. And how they do that is they have a series of questions under one bucket, then another bucket. And wherever you end up answering yes to those questions, you get lumped into that entire bucket. And depending on the bucket, it affects the price. The big one that we've already mentioned is that it can invalidate your policy. So if you do not disclose some of those medical conditions, that's that non-disclosure again. Eligibility is a big one. There are some unique cases of medical conditions that can exclude you. We mentioned them before. That's your transplant, metastatic cancer, and terminal illness. Or every policy will always tell you if a doctor says you shouldn't travel, then we won't cover you for traveling. But there's also the exclusions of coverage, and that's the stability period. So you may have a condition that you've been dealing with your whole life or just the last 10 years, and you're monitoring it and it's been managed very successfully, but something may change in that pre-existing condition that breaks the stability period. And so stability is how insurance companies price when things could be changing. And so there are some policies out there that do not have stability periods, and that's one of the personalized policy that Stephen was mentioning. But I think the next slide will actually go into much more detail about stability period.
Yeah, and just before we move on, I just saw in the comments that someone mentioned that they're having difficulty hearing me. Is everybody having that issue, or is it? Am I clear on most ends? If you can
yes,
let
very
me
clear.
know. Okay.
Clear.
Okay, great. So if we can move on to the next slide, then we're going to go over pre-existing medical. Sorry, the next slide would be
stability period. This is what happens when you read the titles.
So this is what Jason was talking about before, and this is how stability period clauses relate to pre-existing medical conditions and why it's so important to be aware of these. So Jason, if you want to go over the stability clause and what they are and how they work.
Yep. So as mentioned, stability clauses are how insurance companies protect themselves from things that change frequently. So they come with various levels of time, 90-day, 80-day, 365. Sometimes they'll just be presented in months. And that is the period of time where they will cover any conditions that you have under the terms and conditions of the policy, of course. But they'll cover those pre-existing medical conditions and its complications as long as there have been no changes. And the key there is changes. Every policy will have its own definition of those changes. Typically, if there's been no change in medication, no hospitalizations, no new diagnoses, and no treatments that have been recommended but not followed. That does happen where doctors will say, I think you should do this, but it's not pressing right now. And the response will be, well, I'll do that when I get back from my trip. You've still broken stability. The doctor recommended something, and just because you agreed to do it after, it would still constitute that something in your health has changed that requires treatment, that even if that treatment isn't pressing now, it's still a change. So it would break the stability. So the key there.
Yeah, sorry. On the next slide. Okay, sorry.
Go ahead, because I think the next slide is my next point.
Continue with your point. Okay.
Just that you would still have coverage under the policy if you broke stability. You just wouldn't have coverage for anything related to that condition that is no longer stable. And the one thing I always tell customers is the reason stability periods exist is because if there's going to be a reason that you're going to claim, more likely than not, it's going to be because of something broken the stability. So it's very important you understand your stability period and what that means in that policy particularly.
Okay, and if we can move on to the next slide, actually. So stability period clauses, what are your options if you don't meet the stability clause terms?
Yep. So we do have a lot of clients who just take the choice that they're going to wait until they are stable. So they have that 90-day or 120, even 180, and they just delay their travel until they're considered stable so that it's easy. They know they're covered, and then they move on. My preferred option is actually the third one on the screen there, is that they find a policy that does not have a stability requirement or has a rider to cover the stability requirements. And those are specific plans designed that way. And the way we execute them is a personalized plan, but there are other options out there. Most common seems to be a rider, or you get referred to a medical specialist. The one that some clients go with that makes me very uncomfortable is that they purchase the policy knowing that your non-stable medical conditions and any related conditions won't be covered. It's the related conditions that people can get tripped up on, and it makes me very uncomfortable. Customers will tell us they'll do that, and I understand the want to travel is very important, especially if you own property, but you're taking the big risk, and you may have a condition. You may have a cardiovascular condition and not realize that there's some complications from that will land you in a hospital, and there's going to be no coverage for that, even if it isn't directly related to you may have atrial fibrillation in your heart, and then there may be a complication from the heart rate going off, racing or something, and you need to go seek medical attention immediately. We all know this, you hear the stories, expenses in the US are extreme, and just a day or two in the hospital, you may find yourself with a $5,000 or $10,000 bill. So that is an option, but it's one that I'll never recommend.
And it's particularly important because if you do have a medical condition that's not stable, not only will that medical condition not be covered, but any related medical conditions won't be covered. So that's really the concern as well. If we can move on to the next slide, that would be great. And now we move on to the personalized travel medical insurance plans, which is something that one of the options that we offer. It's not the only one. We offer standard medical insurance as well, but the personalized plan is great for a lot of people in different situations. It's not just for people who have a lot of pre-existing conditions, but I'll let Jason go through that as well.
Yeah, so a standard travel medical plan, that's where I mentioned where they've got those buckets. And so here we call it pooled. In the insurance industry, we refer to it as cross-subsidization. And so what that means is we're just picking risks and we're saying, okay, for this bucket, as an insurance company, you can pay this amount in, and then you get access to the pool of funds in the event of a claim. And then the buckets get progressively more expensive depending how the questions are answered. And so that's your standard operation where you call in or you go online or you speak to someone and they have 50 questions that they're giving you and they're asking you very carefully with their jargon and their terms. And they're saying, you know, in the last 5 years, have you had a heart condition? Yes, no. And you click the boxes as you go through, and however you've answered those questions puts you into that pool. The personalized travel medical insurance flips that on its head and simply turns around and asks, okay, what have you been diagnosed with or treated for? And the logic here is that it is scoring and rating you based on your answers and the condition specifically. So you may have a heart condition, and it may be a heart condition that you've been living with for 20 years. And as far as you're concerned, it doesn't need to be a condition anymore. You've been taking your one pill for 20 years, never had any issues. And so this tool will take that and rate it and show that you've been stable very long. Yes, it may be still a heart condition, but it's not a heart condition that needs to necessarily be priced into the highest rate category. The most exciting part about this is because we know what your existing medical conditions are, the insurance companies are comfortable not having a stability payment. So that means that you're going to have the ability to, if you have those checkups or you have a condition that requires changing in medications to fluctuate, warfarin is one of those, you will have coverage for that pre-existing condition, and you don't have to wait for the stability period to pass or restabilize. And it does, because also they're willing to rate those categories. You may have some of the more serious conditions that are expensive, and I'm not saying they're not going to be less expensive if they're one of the more volatile conditions, but you will be able to secure coverage where in some cases other insurers just would not. They feel like they can't put it into a clear bucket.
Yeah, and if you're relatively healthy, you may actually get a better rate from the personalized plans as well. So,
Correct.
So it has a number of different advantages depending on your situation. So we offer quotes on both of these, and then we determine with the client which one is the best option for that individual based on the price and their individual situation. So that's something that
Correct.
we do. And if we can move on to the next slide. Now, making a claim, best practices. I can see we're getting close to our time here, so we're going to go quickly through some of these other slides as well, so we have time for Q&A at the end as well.
Okay, then I'll go quick. So the biggest thing is keep your receipts. Unless you're going to a major medical institution, they're not going to be okay with direct billing, meaning they won't let the insurance company pay. They want their money before you leave that door. So credit card, push the receipt, but don't lose that receipt. Often those medical facilities won't keep records of that for very long or even provide them to you. So make sure that you have them. It's the biggest issue that can cause delays in payments is receipt issues.
And also, sorry, go ahead, Jason.
I was going to say I mentioned it before, but it's very important you contact before seeking medical treatment. There's 2 reasons for that. If you're traveling to a very high travel destination, we will actually have facilities that we can send you to, and we may have already figured out direct billing, so it's painless and easy. We also, though, we know where they are. We've taken the time to research where the facilities are. So if you're in an unknown location, we'll direct you to one that will actually be able to assist you. The big thing, as Stephen mentioned earlier, if this is an emergency, if it's something that you would dial 911 for at home, dial the emergency service where you are. I mean, if you're having a heart attack, get to the hospital. I promise you that the hospital will let you know and let us know that you're there. They want to get paid, but more importantly, you need to take care of yourself. So if it's an emergency, deal with the emergency, take care of yourself. The policy has wording for that and would protect you in that situation.
Great. And if we can move on to the next slide as well. So if Jason covered this already, keep all of your treatment records and receipts. And if we move on to the next slide. So provincial health insurance coverage limits, this is important as well. So, you know, provincial health insurance coverage only covers a small fraction of your costs outside Canada, maybe 3 to 5%. So it's not sufficient. You're going to need to purchase travel medical insurance from somebody if you're traveling. But in order to be eligible to purchase travel medical insurance, you must have active coverage from your provincial health insurance plan for the entire time that you're traveling. And that means that you need to comply with your province's residency rules to maintain your provincial health insurance coverage in order for your travel insurance coverage to remain valid. Now, in Quebec, here is the rule to maintain your provincial coverage. You need to be present in Quebec for at least 183 days per calendar year. However, you don't need to include absences of 21 consecutive days or less, or days of return or departure in that calculation. And there also may be some exceptions where you can apply to the province for extensions beyond that. But you are going to need valid travel provincial health insurance coverage for the entire time that you're traveling in order for your travel medical insurance coverage to be valid. And I think we can move on to the next slide. So deductibles, Jason, do you want to go over the deductibles?
Yep, I'll go quickly. So deductibles are something where you're making an agreement with the insurance company that you're willing to pay the first X number of dollars on any claim. And in return, the insurance company will give you a discount on the premium. The reason they're important to understand is that you make sure that when you're comparing apples to apples, that one, your quotes are being provided at the same level of deductibles, and two, that you know if the deductible is being required of you in Canadian or US dollars. You may buy a policy that's in Canadian dollars and the deductibles may be in US dollars. Right now, the exchange rate's, I think, sitting around 73, 75%. So just be aware that the discount doesn't change with it being US or Canadian dollars, but you will be paying more if it's in US dollars. So just making sure that when you're shopping around, that you're comparing apples to apples when you're seeing deductibles.
Yeah, and the higher your deductible is, the lower your premium will be, and you want to make sure for example, the initial quote we give everybody is the zero deductible so that you're covered for everything. But some other companies may go out there and they may give you a quote, let's say, with a 15 or 10 or 20% deductible, and the premium may seem lower, but it's because they're quoting you with the deductible where you're going to be out of pocket at the beginning. So you're going to want to make sure if you're shopping around, everybody that you go to, that they're quoting you based on the same deductible amount, whether it's zero or some other dollar amount.
Yeah, and the reason why even $500 is on there is because the vast majority of travel insurance claims are small. They're not going to be the massive thousands, hundreds of thousands of millions of dollars that you do hear in the newspapers. The vast majority are the small claims. So when you get the uncomfortable conditions, traveler's diarrhea, any type of gastrointestinal, you're going to probably want to see somebody that's going to be very uncomfortable. And it may be a quick little trip. It's going to be $100 for the visit, whatever the medication is. So if you have a deductible, you're not being reimbursed for any of that.
Okay. And then if we go on to the next slide now. So just quickly, your travel medical insurance may be eligible for a tax credit. So you may be able to claim that on your tax return. Speak to your tax professional about that. Now, the important thing to know is that it's only available for the medical portion of your coverage. So it doesn't apply to trip cancellation or interruption, just the medical side, because it is a medical tax credit you'd be claiming. But you may be eligible, so talk to your accountant. If we can go to the next slide. Okay, what to look for in a travel insurance provider. We'll go over this very quickly because I see we're tight on time now. So price is important, but it's not the only factor. Ultimately, you want to know that your provider is going to be there to cover you and assist you if you actually have to make a claim. That's the most important thing. Coverage features and benefits, they vary widely from provider to provider, so you're going to want to understand those. Specialization, does your provider specialize in assisting snowbirds, seniors, and boomers? Because there are unique factors that they're going to need to be aware of to assist you properly, to compare coverage, to make sure that you have the right coverage available to you. What's the customer service and support like? You're going to want to know that. The track record of the provider. One of the ways you can do that is by looking at online reviews. And one of the things that we do is everybody who purchases a policy from us gets a review request from a third-party service that's verifiable, so they can just post something positive, something negative online about us, and we can't change that review. So you know, we make sure that everybody knows that the client reviews are real and verified from our actual clients. And if you're looking for reviews of an insurance provider, you're going to want to make sure that they offer something similar so that you can verify that their reviews are accurate and from real clients. And if we can move on to the next slide. So more tips and information. You've seen a bunch of links in here. You can go to our website, Learning Center, FAQs. All these topics are covered in depth with more information on our website. If we can go to the next slide as well. So now we'll go to COVID specific. We'll go over these relatively quickly. We might cut into our Q&A for a couple minutes, but I think these are important. So if we can move on to the next slide. So does your policy cover you for COVID? That's the big question that everybody asks these days. Jason?
Yep. So the biggest thing to understand about the COVID pandemic is that COVID, specifically the condition COVID-19, was never listed in policies and excluded. However, what occurred was the travel advisory issued by the Canadian government went up to a level 3, meaning avoid non-essential travel. And in the case of cruises, avoid all travel, which is a level 4. And all travel insurance policies have some version of a travel advisory exclusion, meaning that prior to your departure, if an travel advisory is in place, you will be excluded for coverage related to the travel advisory, or in the case of a medical condition like COVID, excluded for any conditions related to medical conditions as a result of the travel advisory. So right now, the travel advisory was changed on October 22nd, and it's up for interpretation. So right now it's been lowered, but there are some insurers who are also reading that travel advisory right now to say, if you're unvaccinated, it would still be considered avoid non-essential travel, meaning that most policies will not respond. If you're vaccinated, most insurers are reading that to say it's a level 2. What is it, level 2? I already forget. It's exercise
high degree of caution. Yeah.
Thank you. And so there are some policies that exist out there that name COVID-19 specifically, and they also will have their own conditions. So it's just important that before you purchase, you ask your travel insurance provider, what is their stance on COVID-19? But the answer is right now. Go ahead, Stephen.
And just for clarification, our policies, if you're vaccinated, our policies do cover you for COVID.
Correct.
And if we can move on to the next slide. Now, quarantine coverage, this is a question we get a lot as well.
Yeah, so there are some policies that are specifically out there for quarantine coverage. However, with the lowering of the travel advisory to that level 2, if you're vaccinated, I can speak specifically about our companies. Our standard policies, as well as those personalized, have an included coverage of $200 per person per day, up to a maximum of $2,000. And so that quarantine coverage is for additional expenses like accommodation, meals, flights, whatever is required, beyond what you had already paid. So that's a key point. So if you're quarantined at the beginning of your trip, you might not see much coverage if you were already covering to pay for food or lodging, and all that was covered. However, if now you've been maybe quarantined to a room or your own home, and you now have to pay for additional fees, like to have someone deliver groceries, if you're in your own lodging, or if you're in a resort and now you have to have room service provided, there's an additional cost. It would have coverage for that as well.
Okay, and if we can move on to the next slide. Now, trip cancellation, interruption insurance. Now, we went over this before. Now, the general rule of thumb now is that we're not aware of any trip cancellation interruption coverage that will cover you for the interruption portion if something happens while you are away traveling due to COVID. But they will cover you for non-COVID related trip cancellation interruption issues. Now, what our policies will cover you for is if you, let's say you get COVID, you book a trip, you get COVID before you leave on your trip, and you have to cancel your trip because of that, you will be covered for that specific reason if you get COVID. Not all trip cancellation interruption policies do cover you for that, though some won't even cover you for that. I think that's the overview. Jason, is there anything else to add to that?
Yeah, I just wanted to mention that with our policy, if you are at destination, you'll be covered for that, again, only if you catch COVID, because they're covering that under it's a sudden or unforeseen medical emergency. Before your departure, though, if you do test positive and you're asymptomatic, you will still have coverage, as you are still sick to the point where you cannot travel. The planes aren't letting you on, but just to clarify that.
Okay, and if we can move to the next slide. Okay, so does your policy cover you for variants? We can go through, Jason addressed that earlier.
Yeah, real easily. There's no difference between the variants as far as the wordings are concerned. So if like Omicron's in the hot news right now, it's what's driving a lot of the questions to us. And so it's not a different disease, it's still COVID. So unless the government issues an advisory against specific variants, you would be covered just as you would under any other COVID situation.
Great, and the next slide. Okay, so are COVID tests covered? So just very quickly, COVID tests for the purpose of travel, for returning to Canada or leaving Canada, if you require a COVID test, those are not covered under your insurance. Only medical related COVID tests would be covered, and they must be prescribed by a doctor. Let's say you're showing symptoms or they think you may have COVID and it's prescribed by a doctor, that would be covered under your travel medical, but not your general COVID tests for travel purposes. So those would not be covered. And now if we go to the next slide, and now more COVID travel insurance information, you can find it on our website at this link. And if we move to the next slide, I think there's just some information, contact information for Snowbird Advisor Insurance, for Snowbird Advisor. And now I see we've eaten into our Q&A a little bit, so we'll open up the floor to everybody for questions now.
Thanks, Stephen. I actually have a question. I will get everyone going while they think about what they've just seen and give it some thought. We know that things are changing really quickly right now. So if someone has bought insurance, let's say 2 weeks ago, and they're planning on leaving in a month, what should they be watching in the news that would encourage them to get back in touch with their insurance provider? What are the circumstances where they should really double check and make sure that they're covered? Or what would you recommend that they keep an eye on to make sure that they are leaving and still covered the way they understood they were?
Yeah, on the emergency medical portion, the key thing to look for is any time an advisory has been issued. There's very few instances where the government's going to make a change or a decision about how they handle the borders that will affect the emergency medical portion, but those travel advisors are the key thing. So there's the travel advisory website. It's Canada, so it's canada.travel.gc.ca. That website right now, the newest travel advisory is to South Africa, and it's actually about the inability to travel home. So there's no medical impact, but you would lose any coverage as a result of needing to get additional cost to fly home. So the news will tell you if Canada makes some big, colossal changes. My recommendation, though, is actually pay more attention to that travel alerts website and make sure that you are aware of any advisories prior to traveling.
And we do have a link to that in the second section of this presentation that we'll be doing after 11 o'clock. There is a link to a bunch of resources, and one of the resources is that website. So you'll be able to find that link later in the second presentation.
Okay, great. Thank you. I have another question because I don't see any others coming up through the chat. So I'll go through mine.
I have one.
Oh, okay.
My name's Linda, and I'm going to New Brunswick over Christmas. I've registered, got the application, haven't yet gotten the confirmation back that it's, good to go. So that's one thing. The other thing is I have family that live in the United States and I'd like to go there. So if you're looking at insurance coverage, is there any appreciable difference in cost and coverage going to Canada and staying within Canada or going to the US, for example?
Yeah, that really depends on the underwriter. So there are some underwriters that don't put a difference out of province versus out of country. And then there are other underwriters who will give you a large substantial discount for inter-province versus out of country. My recommendation, though, is if you're going to travel outside your home province and then to the US, is to buy an out-of-country policy. More likely than not, when you read the actual eligibility of the travel, it will either say the effective date of your trip will be when you leave your province or leave the country. So it's just important to note when you're purchasing which one so that you're covered for both situations.
I have another question here, and this is interesting about traveling within Canada. What healthcare and hospital emergency treatments are covered for Quebec residents who are traveling in the rest of Canada? Can we assume that we're going to get the same coverage elsewhere?
So that's a very specific question that there's a bunch of lists that I got to back up a bit. Every province's healthcare plan is an insurance company and policy. They operate pretty similarly. We don't think of it that way because we all have access via citizenship and taxes. Residency, I guess, sorry, it's not citizenship. Provinces have subrogation rules amongst themselves where they will handle certain things up to certain costs. Most of the time, those costs are in line with themselves. However, since there are some situations we've been aware of where one province will say, well, listen, I don't charge that much, or I charge more for that condition, we're only going to pay this much. And then any additional funds do fall to the insured person or the person who sought medical attention. The other thing to be aware of is the emergency services. So those can be quite costly if you're not from that area. If you're paying taxes to your local area, I know someone who just had a hospital trip. It's like $50 for the ambulance. Not from that area, it could be $500, a couple $1,000s. I know if you're traveling to BC or Alberta, any of those rescue costs. So if you're getting airlifted from Banff out to Calgary, that can be $15,000, $16,000 for that airlift. So it's just other things to consider. But most of the time, for your vast majority, the provinces will share costs, subrogate with each other.
Okay, great. Here's a question about the US again. So we are dual citizens traveling to the US. We have basic US Medicare coverage with our Social Security status. Would this reduce the cost of medical travel insurance to the United States?
Typically not. That's not a common enough occurrence for insurance companies to have created discounts or policy codes for that situation. I'm unaware of any. I understand why there might be some shared costs there, but right now those policies don't exist as far as I'm aware.
Okay, so there's a couple questions here about the recording of the session. Yes, it's being recorded. Yes, we will send it out to everybody in the next couple of days with the presentation. So whatever you're missing, don't be concerned. You'll have all the information to be able to come back and check. Evelyn here has a question. It's not really, well, it could be insurance actually. If you have refundable Air Canada tickets, do they give you back your money or do they refund you in vouchers?
That really depends on the airline and what their policies are and the level of ticket that you're purchased. So that's really between the consumer and the airline as opposed to more of an insurance question.
Okay, here's a question that I think concerns a lot of people. What if I buy insurance for a trip to the US and then the border's closed and we can't go? Will I get a refund on the insurance policy itself, or will I have needed to have gotten trip cancellation on top of the policy
to cover the cost? I like that loophole. Yeah, no, that's not the way that works. That's good thinking though. Most policies will allow you to cancel as long as it's prior to the effective date. So if you were leaving January 1st, and the borders closed December 20th, you would cancel before January 1st, you'd get a full refund. There may be some types of administration fees or costs to cancel. Clarify that with your purchaser prior to, so what would happen in the event of a cancellation. But you wouldn't need to purchase that trip cancellation to cover the emergency medical costs because it would be considered refundable. So the key there for trip cancellation interruption is to know the difference between refundable costs and non-refundable costs. Because you may go on a $10,000 trip arranged through a travel agent, and it may be that up to a certain date, all of it can be refunded. Then past a certain date, only $5,000 can be refunded. So we recommend to people know those dates, purchase the trip cancellation once it becomes non-refundable, because trip cancellation interruption coverage is very different than emergency medical. It doesn't start on your effective date. It starts the date you purchase it. So if you purchase trip cancellation and you find out later that this amount is refundable, it's too late. The policy is enforced. It's not going to be canceled. So it's important you understand the difference between a refundable cost and a non-refundable cost.
Okay. All right. That's good to know. Here's another one. I have worked in a walk-in clinic in Ontario, and they will not cover Quebecers because Quebec doesn't repay the full amount of their bills.
That sounds right. So I think in Ontario, I'm not going to quote pricing, but yeah, we've heard that.
That's interesting because I live on the border of Quebec and Ontario, and we go to the hospital in Ontario because the service has been better. And they've been fantastic. They're like I know that they actively try to get Quebecers to come because the money comes in on top of their normal operating budget. And so they're very much the opposite, like bring on the Quebecers.
Yeah, in the industry, we also handle some domestic. And so yeah, hospitals they have a set charge for their home province people, and then a different charge. Listen, we're not much different than the US. We just have governments paying for us. So the pricing is different. They get paid more money for people out of province.
Yeah.
Can I ask a question again? Vanessa, where do you live? Which border?
Linda, I'm in Rigaud in Western.
Oh, okay. So okay. On the way to Ontario, Cornwall, that sort of thing?
Closer on the way to Ottawa, Hawkesbury area.
Okay.
I saw there was an interesting question here about sleep apnea diagnosis, Jason. I'm not sure if you want to field that one.
What's the question? Sorry.
What about sleep apnea diagnosed 15 years ago, but you don't wear your CPAP machine?
You're asking if you would be stable or if you would be covered? Sorry.
It's not clear on that front, but I guess would you be?
You're stable.
Covered?
You're stable.
Okay, so if you're stable, but you're going, so the key there is to note are you going against prescribed treatment. So if it's just been recommended for comfort, but not necessarily any medical obligation, you would be fine on stability. If your doctor's notes say that you have to take this sleep, you have to use your CPAP machine to prevent whatever the reason is, then actually any complications of the sleep apnea wouldn't be covered because you'd be going against medical advice.
Okay.
So here's one. How long does it take for last minute short term, like a weekend visit to Vermont policy to go into effect?
You call, so I can speak for what the insurance I sell. As long as you speak to us prior to departing Canada, we can do it in the same call. That's the key though, is making sure that you know your medical conditions and can answer honestly and accurately. We can put it in, like if it's, as long as we're open. So I guess I'll put that into play as well. If you're still in Canada and you're leaving at 5 p.m. and it's 4:30 and you're in line at the Ambassador Tunnel here in Windsor to cross over to Detroit, if you're still in Canada and you can get through it before you travel, it would be valid.
Now, on that note, I want to make a couple of quick points. Right now, with everything that's happening with the rush to travel coming back, we are experiencing longer than normal wait times. We're making changes right now to alleviate that to our system, but we're bringing on more agents. We're making some changes to our phone system, some improvements, but there are extended wait times at some periods right now. So you do not want to leave this till the last minute if it's at all avoidable. And again, right now we're open. We're not open 24 hours a day. I mean, in an emergency medical situation, there is an emergency center you can call in 24/7, but to actually purchase your insurance, we're open 8:30 to 7 Monday to Friday at this point. So you don't want to leave it till the weekend, you don't want to leave it till after hours, and you don't want to leave it till the last minute in case there are longer than normal wait times right now.
There is an online tool, and if you're comfortable going through that process yourself, if you're confident, then you can also purchase during off hours through that online tool. It'll have a timestamp at time of purchase.
That is available 24/7. Sorry, go ahead.
Yeah.
I have a question. Stephen, you gave something different in answer to Jason. So are you talking about Quebec coverage being perhaps less immediate versus what Jason said will cover you immediately? Is that provincial?
No. You'll be covered immediately, regardless of where you're calling from. I'm just saying that right now we're experiencing high call volumes and we're very busy. So you don't want to leave it till the last minute simply because you might not be able to get through on the phone lines if it's the same day or a few hours away from traveling. So you're going to want to try to secure your insurance earlier. But if you're able to get through, what Jason said is absolutely accurate. If you could be on the road in the tunnel crossing over to the US and you can get coverage at that point. It's just about call volumes right now. That's what I wanted to warn everybody about.
I used an extreme example of you calling right before you cross the border, and Stephen just wants to make sure that you don't actually call right before crossing the border in case you don't speak to us before you cross the border.
Thank you.
Thank you, everybody. Oh, I've got one last one coming in, and then I'm going to give everyone a chance to go heat up their cup of tea. On the chance that there are several last-minute decisions to go over the border, should it be cheaper to take out an annual policy?
So the last-minute decisions don't affect the price. The reason why I say 2 trips or more with the annual policies are because they're typically priced at 2.2. The cost of a single trip for an equal length. So if you're traveling, and this is a generalization, this is not a hard mathematical equation for how they're priced, but typically if you're traveling twice and you're going once to the maximum days of your trip, you're going to be saving money on the multiple trip plan versus if you're going to be taking 2 single trip plans. Your immediacy, I would change that question to be, if there's going to be a lot of last minute decisions, I'm going to get an annual plan, so I don't need to call my travel insurance last minute.
And then if you need to stay longer, you can, when you're away, you can actually get a top up to that annual plan, because you can get a top up out of country, but you can't buy a policy out of country.
Correct.
Another quick question.
Linda, do you mind go ahead quickly, and then I'm going to ask that you use the chat box.
Okay. Do you work when you're saying out of country policy when you're traveling in December 2021, but then your policy you want it to go through to 22? Do you work calendar years, or how does that work?
The policies are annual from date of purchase. So if you buy them December 20th, 2021, it will expire December 19th, 2022.
Thank you.
Okay, everybody, we're going to take a little break. Thank you so much. Go get your cup of coffee, go to the washroom. We're going to come back in about 5 minutes. and keep going with Jason and Stephen. So thanks very much. Again, if you have questions, feel free to put them in the chat box. I'm keeping track of them, and we'll do our best to get to all of them. Sometimes it happens that we get too many and we run out of time. We do send them along to the presenters afterwards to make sure that if they can, they will send you an answer. So even if you see that we're wrapping up, feel free to send them along anyways.
And just a quick note, Jason won't be joining us for the next presentation, so we want to thank him for joining us and taking the time. Thank you very much, Jason. And the next presentation is going to be on general Snowbird topics, as well as real estate and how long you can stay in the U.S. and tax and legal issues.
Yep, but if there are any other insurance questions, I'm happy to answer them if you forward them on, Vanessa, for sure.
Great, thank you, Jason.
Have a good day, everyone.
All right, see everybody in 5 minutes. Again, we're a fairly big group here, so if everybody can leave themselves on mute, that would be great. It just makes it much clearer and easier for the presenters. If you can leave your camera on, great. It's always nicer for a presenter to see people rather than to see a screen of names. But of course, if you are having trouble with your stream, if you see that it's stuttering or it's cutting out or freezing, turn your camera off. It can really help things go a little more smoothly for your internet speed. So we're coming back and we're going to be hearing from Stephen again. He has a few more tips for us when it comes to COVID and insurance. Stephen, go ahead. Thanks.
Okay, so if we can start the presentation, that would be great. So this presentation isn't really related to insurance. This is more about general tips and information for snowbirds who are going away for the winter. And we can't cover everything here, but we're going to cover some highlights. We're going to point out some issues. We're not going to do a deep dive into these issues because, again, we don't have time. But I want to cover a few things here. So if we can go on to the first slide. And I'm not sure if we have anybody here who wasn't here for the first half of the presentation, but just in case you missed it, a brief overview about Snowbird Advisors. So we're a one-stop resource for Canadian snowbirds. We provide news, tips, guides, articles, tools, services, and more. We cover a variety of topics like travel, destinations, accommodations, RVs, real estate, insurance, health, tax, legal, finances. And we also have free memberships available on our website. So all you have to do is go and sign up and you can get our newsletter. You have access to certain services and discounts as well. So it's pretty simple to sign up on our website and it's free. And if we want to go to the next slide, Snowbird Advisor Insurance, we specialize in providing Canadian snowbirds, boomers, and seniors with travel insurance solutions to meet their unique needs. We compare and contrast prices to make sure that you get the right coverage at the right price for your unique situation. And where we differentiate ourselves from a lot of other people is we educate our clients about travel insurance to help them make smart choices and avoid pitfalls, regardless of where you buy your insurance, whether you buy from us, whether you buy from someone else. We just want to make sure that you're educated and knowledgeable, and the information that you learn from us is really transferable to any insurance provider. And we also offer personalized travel medical policies with no stability period for pre-existing medical conditions. And if you were on the first half of the presentation, you know why that can be so important. And now if we want to move on to the presentation, the next slide, please, Vanessa. Great. So here are the current COVID travel rules and restrictions. This is what we get a lot of questions about this. What are the current rules right now? They can change quickly and without warning. And with the new Omicron variant, Canada, the US, and other countries have quickly imposed new travel restrictions and testing requirements. Now, we will probably see that in the future. So as well as new variants come up and the COVID situation changes. So for here, let's go over Canada and the travel requirements first. So all travelers aged 12 years and up must be fully vaccinated to board a plane, train, or marine vessel in Canada. And now all travelers must use the ArriveCan app or online portal to provide required information within 72 hours prior to arriving in Canada. Now, recently that just actually changed yesterday because a number of people were having issues with the ArriveCan app. So now if you're unable to use the ArriveCan, you can actually go and present that information in person when you arrive at the border. And, you know, returning to Canada, you're required to present a negative molecular COVID test taken within 72 hours of arriving at the border unless the trip is less than 72 hours. If it's less than 72 hours, you don't have to provide that test. Now, that's if you're returning by land. Now, if you're returning by air to Canada, you're required to present a negative molecular COVID test within 72 hours of your scheduled flight departure time to Canada, again, unless the trip is less than 72 hours, in which case you don't have to provide a test. And for flights arriving from countries other than the US, you have to take a COVID test upon arriving in Canada and quarantine until you receive your test result. So if you're arriving from the US, you don't have to take a test upon arrival currently and quarantine until you receive your result. But as the Omicron variant changes, we may see changes to those rules in the future. But right now, the arrivals from the US directly are exempt from that requirement. And now if we can go on to the next slide. Now, traveling to the US, all arriving travelers must be fully vaccinated and show proof of vaccination. And the acceptable vaccines are Pfizer, Moderna, Johnson & Johnson, AstraZeneca, as well as mixed dose vaccines, which we know was a big concern for a lot of Canadians who received mixed dose vaccines as well as AstraZeneca. So that's a positive. When you're driving to the US, there is no COVID test requirement for Canadians driving there. There's also no quarantine requirement for Canadians driving to the US. But if you're flying to the US, you have to have a negative COVID test taken within 1 day of your flight. It used to be within 3 days of your flight, but now it's within 1 day as the Omicron virus has become more prevalent. So they've tightened up the testing requirement rules. You're able to take a rapid antigen test to go to the US, which is something that Canada doesn't allow at this point. So rapid antigen tests are faster, less expensive than COVID tests. So you can get a turnaround time a lot quicker. They're a lot cheaper. So there's a big advantage to taking an rapid antigen test. You can also do them virtually in some cases if they're supervised by an approved healthcare provider. And again, no quarantine requirements when you're flying to the US. And if we go to the next slide. So Mexico, when we're just going over some of the primary snowbird destinations, obviously the US and Mexico being the two biggest, and other destinations, they vary by destination. So for Mexico, there is no COVID testing requirement, no quarantine requirement. The only thing you need to do is fill out a pre-arrival travel health form, and you can find that in the government's website, the Mexican government's website, and your airline will be able to provide that to you as well. And we might have a link to it later in the slide presentation. And if we can go to the next slide. So crossing the border, you're going to want to be prepared when you're crossing the border, whether you're flying or whether you're going by land, especially if you're a snowbird, because it can raise questions when you're spending an extended period of time in the US with the US Customs and Border Protection officials. So you're going to want to have everything in order. You're going to want to know your date of return to Canada, the purpose of your trip. You're not going to want to raise any alarm bells or make it seem suspicious. You're going to want to have your passport, your Nexus card, check the expiration date to ensure they don't expire while you're away. If you're going to be renting or you own property, make sure you have proof of your US property ownership, some sort of deed, or if you're renting, you have a rental agreement just so they know how long you're staying for or that you own property in the US. It's not often that you get asked these questions, but you may be asked these questions. So you want to be prepared just in case to avoid any potential issues. If you're driving, you're going to want to have your vehicle ownership and your registration documents. Other documents and considerations, your driver's license, your provincial health card, your travel insurance policy and emergency contact card just for yourself, your vehicle insurance if you're driving, and you're going to want to declare all food items because you don't want to run into any issues. They may confiscate some of them if they're not available, if they're not allowed into the country, but just declare everything. Let them decide what you can and can't bring in because you don't want to be seen as bringing anything in that you're not supposed to bring across the border. And if we can go to the next slide. This is very important as well. We do hear a few issues every year of people, snowbirds, running into problems at the border. Just remember that all of the US CBP officials have a supervisor on duty. And if you're running into an issue with an individual at the border, ask politely to speak to their supervisor because they may be able to resolve the issue for you. And you can find more information on our website. Again, we've included links so that you don't have to take notes on this. And the next slide. So provincial health insurance plan, we talked about this before in the context of getting travel insurance, but spending too much time outside your home province can result in losing your provincial insurance coverage. And obviously not something you want to do, and a concern for snowbirds who do spend extended periods of time outside of their province. You know, make sure you meet the residency requirements to maintain your provincial health insurance coverage. You know, as we mentioned earlier, losing your provincial health insurance coverage doesn't just have implications in your province in terms of you being covered for healthcare, but it also may invalidate your travel insurance as well. So in Quebec, we covered this before, but I'll go over it again. To maintain your provincial health insurance coverage, you must be present in Quebec for at least 183 days per year, per calendar year. Absences of 21 consecutive days or less, and days of return or departure outside, days of return or departure are not included in this calculation. So it can actually be a little bit more than 183 days depending on your travel patterns. Now, some exceptions may be available for longer stays outside Quebec, but you're going to have to look on the provincial website and also potentially contact and apply to the government for exemptions. Now, if we want to go to the next slide. Prescription medication. Many snowbirds do have prescription medication. If possible, you're going to want to make sure that you bring as much medication as you need for your entire trip if you're going for an extended period of time. This sometimes requires a request from your pharmacy to your insurer. It's not always available from provincial or private insurance drug plans. They sometimes won't give you extra medication for extended periods. You know, we do have a partnership with a virtual pharmacy that can help with this. There's a link to it here. It's called Pillway. It's a great program if you're interested in looking at that. And if you need prescription medication for longer periods of time, they'll also ship it down to the US for you if you run out of your prescription medications if you're a client. So it may be worth taking a look at if that's a concern. Keep your medication in the original packaging because they may inspect it when you're going over the border, and they're going to want to know what you're bringing in, and they're going to want to see all the labels, and they're going to want to see all the pills divided up as they should be divided up, because you could run into potential issues otherwise at the inspection point when you're crossing the border, either flying or driving. And you're going to want to keep your medication in your carry-on as well so that you can show it to the CBP officer who may be allowing you or determining your entry into the US. You're not going to want to have it in your checked bags. Now, if we can move on to the next slide. Home and auto insurance, something that you're going to want to look at as well. So if you're driving down to the US, inform your auto insurer that you'll be taking your car outside the country. Find out how long your car will be insured outside the country. Usually there's a 6-month limit, so you're going to want to be aware of that. Consider getting extra liability insurance in the US, as injury claims can be more expensive if you have an issue in the US. So your liability insurance in Canada might not be sufficient. You may want to increase that for the period you're in the US. Now, if you're leaving your vehicles in Canada, you might want to contact your insurer to suspend or reduce your insurance coverage because you can often save money if you're not going to be using your car. So something to be aware of as well. Home insurance. Make sure you have a friend, a family member, or a home watch service. Check in on your home regularly in accordance with the terms of your policy to ensure claims for damages aren't denied. If you're away for an extended period of time and you don't have your property checked on in accordance with the terms of your home insurance policy and there's damage to your property, you may run into an issue making a claim later on or having your claims paid. So be aware of that. Now, if we move on to the next slide. So currency exchange and banking, if you're going to be spending a lot of time out of the country and incurring expenses in a foreign currency, foreign exchange fees can really add up. So here are a few solutions that you're going to want to look at, and sometimes you'll use one of these solutions. Sometimes you might want to use a combination of these solutions to help save on foreign exchange fees. So discount currency exchange program. We have a program that you can sign up for. It's a discount program, the Snowbird Advisor FX program. It's on our website. There are others as well where you can save on the foreign exchange fees and exchange currency at a much more favorable rate than you would get from the banks or other currency exchange providers. There are also cross-border banking solutions from some of the major Canadian banks So you can open up a US bank account with their US arm. You can get a US credit card or an ATM card. So you might want to explore those as well. In Canada, there are no foreign transaction fee credit cards available. And you also maybe want to get a US dollar credit card, but issued in Canada as opposed to the US, which would be number 2, the cross-border banking solution, where you would actually get a US dollar credit card issued in the US, but number 4, you can get it issued in Canada. So just a few things to consider to help save you money while you're away. Next slide, please. Now, here are a bunch of helpful resources for you to look into. You can find these on our website. There's Snowbird Advisor, obviously, Snowbird Advisor Insurance, the Government of Canada travel advisories. We mentioned that in our first segment about travel insurance. You can check the travel advisory status level for your destination on the Government of Canada website. Here's a link to the COVID travel rules from the Government of Canada, US Customs and Border Protection, the US CDC. They'll make up a lot of the rules for what you have to do to enter the US in terms of testing and other requirements. The US Department of Homeland Security, as well as the I-94 website, which keeps track of your travel records for US visitors. This could be an important resource for you, and Shlomi might touch on that during his presentation. Now, if we want to move on to the next slide. So coming up in the next presentation, we're very fortunate. We have Shlomi Levy from the law firm of Levy Salas in Montreal, also with offices in Toronto, as well as, I believe, presence in the United States. And he is a cross-border tax, legal, and real estate specialist. So he'll be touching on the topics of how much time you can spend in the US from a tax perspective or an immigration perspective without running into issues with the US government, as well as buying and selling US real estate and the things that Canadians need to consider, because many snowbirds do consider purchasing a vacation property in the US. So he's going to take away the next presentation, and he'll fill you in on all the details on that front.
Thank you for that, Stephen. So just quickly before we let Shlomi start, I just want to remind anyone who has questions either from Stephen's presentation, which was super helpful. Thank you. I was taking notes and I'm going to send them off to my mom. But if anyone has questions either for that or this upcoming section, please just pop them into the chat and I'll keep an eye on them for you. I just wanted to come in and thank our speaker, Maître Levy, and read a little bit of his bio so you know who you're hearing from. Maître Levy was the co-founder of one of the leading cross-border tax and estate planning law firms in Canada prior to funding Levy Salas LLP. His practice is dedicated to United States and Canadian tax and estate planning for individuals and corporations, Canadians doing business in the US, US real estate, transaction for Canadians and Americans living in Canada. Domestic and international trusts, international taxation, and corporate law are all part of his practice. Clearly a busy man. He's frequently invited as a speaker throughout North America for conferences on cross-border tax and estate planning questions. Sorry. Mr. Levy has been interviewed for many publications such as the Wall Street Journal, the Globe and Mail, the National Post, La Presse, and the Montreal Gazette, to name a few. He obtained his Bachelor of Law from the University of Montreal in 2012 and his Juris Doctor from the same university in 2014. Prior to his studies in law, he received a Bachelor in Arts with his honors from history in McGill University. So thank you so much for joining us. I really look forward to this section, and I hope it's really helpful for those of you who either own real estate in the US, are thinking about it. So thanks again, and take it away.
Thank you so much, Vanessa, and a big thank you to everybody who's attending today. Sorry about the long bio. It's kind of embarrassing sitting here and listening to it, but thank you for the beautiful introduction. As Vanessa said, we manage a Canadian's lifestyle across the border with our expertise. As Stephen said, we've got offices both in Canada and the US, and we actually like to say that we speak Canadian in the US, which is not given to everybody. So without further ado, we can get into the presentation, and we can pretty much go through what are the ins and outs of the US model, what are the issues affecting Canadians, and how to navigate the process of owning or looking to buy and what are the issues affecting Canadians. So without further ado, if we can go to slide number 4, because we don't need to see my picture again. Perfect. So when Canadians want to buy or are already owners in the US, I think that we stop the only similarity between the two systems is finding where you want to be and finding an agent. Once you've done that, the rest is the systems are complete polar opposites. Some lingo or some terminology that we like to use in the US starts with title search. What happens to the titles? Who does it? In Canada, we have title attorneys. In Quebec, we have notaries. No such a thing in the US. So we're dealing with title companies. They're going to do title search. They're going to insure title. They're going to do lien searches. They're going to unravel open and expired permits. They're going to find code violations when people do renovations and don't do them according to code. If condominiums are involved, there's going to be estoppel letters and notices of commencement from developers and from contractors and subcontractors, special assessments, stamp tax. In Quebec, it's called the welcome tax. In Ontario, it's called provincial tax, or pretty much value tax. Mutation tax is the right term. In the US, we call it the goodbye tax or documentary stamp tax, closing affidavits. And the big question becomes who pays and for closing costs and at what point. Next slide, please. Moreover, the contract itself on the US side is slightly more complicated because there's two types of contract. There's the as is, without any legal warranty, or with legal warranty. How to properly identify the parties. What do we include in the contract? A lot of Canadians end up buying or selling fully furnished properties. What do you keep? What do you exclude? What are the closing dates? What are the inspection clauses? In Canada, we typically inspect the roof and the foundation. In the US, you're doing all that, but you're also inspecting for termite and you're inspecting for mold, because, if you're like me, we don't go to Vermont or Alaska. We go to Florida, we go to Arizona, we go to California where it's hot. Wood destroying organisms are there. What are the exit clauses that you want to have in your contract in the event that you need to back out, right? Pandemic hit us about almost 2 years ago. People were all geared up to buy their Florida condo, their dream. And then pandemic hits, the borders are closed, and everybody's rushing to cancel their deals, right? Only if you have the right exit clauses. But fundamentally, the biggest question for Canadians either buying or owning property in the US is, how do they take title? How do they own it? Next slide, please. So this chart pretty much will show us the most popular ways for Canadians to own property in the US. And each category has as its own kind of subcategory or sub-ownership structure. So in one's personal name, you could buy alone, you could buy with a partner as joint tenants, you could buy with a partner or a family member with right of survivorship. You can also do a life estate, which we'll talk about. Trusts are extremely popular in the US because of certain elements that we're going to present to you in the next few minutes. But trusts are very important and very popular. But here again, what type of trust do we choose? Is it a Canadian trust? Is it a US trust? Is it a revocable trust? Is it an irrevocable trust? Is it a cross-border trust? In Florida, we have land trusts. There are Massachusetts trusts. There's all kinds of trusts available in the US that we want to make sure if the client has a trust, we want to make sure that the client is in the right type of trust. From a partnership perspective, those are really set forth for people who are looking to do some business, and corporations are extremely popular in Canada, but here again, it depends on the usage of the property, which we'll see in a few minutes. Sometimes people's money are in corporations because of the high taxation rates in Canada. So we want to make sure that we keep all the options open. Next slide, please. So without further ado, we'll go into a few scenarios that are a bit of a headache for Canadians. It's a little bit interactive, and then we'll figure out how to break this down and come up with some more concrete solutions for the people in attendance. So the first scenario talks about probate. Probate is the legal procedure to have one's will homologated and one's estate settled in the common law world, not in Quebec, but everywhere around Canada. And obviously in the US, it's pretty significant. Now, all our examples speak about Florida, but know that whatever we say here applies practically across the board in the US and everywhere else in Canada. So the scenario reads as follows. We bought a condominium in Florida for $300,000 and put title in my husband's name alone. Everything was fine until he passed away. After that, I couldn't sell the property because the estate was frozen. Probate took over a year and cost between $10,000 and $15,000. So the first question is, can we avoid probate because we have a will? And under US rules, the answer is no. Now, I'm gonna maybe surprise a few people by confirming that your Canadian will, your Quebec or Ontario or any Canadian will, is valid in the US. It's valid with respect to its content, but it's still subject to probate. In Quebec, for instance, we do have a notarial will done before Quebec notary that is completely exempt from probate. But on the US side, every will has to go through probate. So when people tell us, well, we've been advised to get a US will, great, your Canadian will is just fine, but you're still gonna have to go through probate. And we don't like probate because under US and Florida rules, more specific, probate is a very long event. It could take anywhere between 12 and 24 months to complete. The asset is completely frozen. And then we have to worry about expensive fees and procedures. And the last thing that I hate about US probate is that all the procedures are completely public. Anybody could type your name or the deceased name and know who the executors are and what assets are left in Florida and what are their values and so on and so forth. So we definitely want to stay away from probate. Next slide, please. So speaking of probate, when Canadians go down to the US or speak to their attorney here because they own a property in the US and they're told, look, there's going to be probate in the US, you should have a US will. Well, as I mentioned, your Canadian will is valid. Some people in Quebec may have a will drafted in French, so maybe it's a challenge to have it translated later on. So they suggest having a second will. And so we want to make sure everybody is aware and are careful on the way they create multi-jurisdictional estate planning documents. Why? Under every will, one of the first paragraphs is that you revoke any wills executed by you prior. So that if you have a Canadian will and you go and you execute a US will, if it's not done properly, you may very easily revoke your Canadian will and be left with a very simple basic will on the US that now handles the entirety of your assets, including Canada. And more importantly, we want to make sure that whatever wills you're doing are, we call them situs will, they're specific to a state or a place, and we want them to deal with those assets specifically and only those assets. So beware if you're ever told to have a second set of estate planning documents, make sure that they comply with the advice and make sure you're always visiting a cross-border expert that can make sure that both wills can coexist at the same time. Next slide, please. The other big concern for Canadians is the issue of incapacity. So we know that in order for your will to kick in and for probate to start, somebody has to pass on. But there's more and more scenarios where people don't die, unfortunately, but they become incapacitated. They become a burden to the families. They are not themselves. It's a very, very difficult situation for the families. And the scenario reads as follows. My parents own a condominium together in Florida, but they can't enjoy it anymore since my mom developed dementia. My dad couldn't sell the property because of my mom's condition. And so we had to go and do a costly and time-consuming Florida guardianship procedure. Here again, whenever a situation like that occurs, there must be US court intervention. Unfortunately, unlike your Canadian wills, a protection mandate, an incapacity mandate, or an Ontario POA isn't necessarily valid in the state of Florida. And so in order to gain control over the incapacitated person's assets, we need to petition the courts. Here again, long delays, a lot of expenses, public procedures, no closure, and during the whole time, everything's frozen. And so we want to make sure that we get the right tools in hand to avoid these pitfalls, to avoid these delays, and to provide some peace of mind to the family and those who remain behind, whether it's a spouse or downstream children and grandchildren. Next slide, please. Another big consideration when we're owning in the US or looking to own in the US is to deal with the question of what happens with our assets if we're no longer around. Now, rest assured, I am just giving you the concerns, and this should not deter you from thinking of buying, or if you already own and start thinking that I want to get rid of it, only because these are the issues affecting Canadians, but there's all solutions, as we will see in a few minutes. This scenario reads as follows. We are worried about what happens to our kids after we pass away. And what happens if my son inherits my $300,000 house in Florida and then his business goes bankrupt? Can his creditor seize the house? Also, if his wife divorces him, will she get 50% of the property? And of course, the example could read, you know, my daughter, and if her husband divorces her, will he get 50% of the property? Also, what if I want to add children onto title? So let's just say this. Your Canadian wills are going to be good in the US. They're going to go through probate, but they're not necessarily going to give the outmost tax and estate planning mechanisms that you would typically have in Canada, and they won't render them valid on the US as well. Now, some people hear about probate, some people hear about incapacity, and are told that if you add your kids onto title and you make them as joint tenants with right of survivorship, you can avoid probate until last to die. And then you don't really have to worry about any of the stuff we told you about probate, and that solves the problem. And from a legal perspective, the answer is absolutely, they're right. If you added people onto title, or if you bought with 4 people as joint tenants with right of survivorship, on first to die, the 3 remaining owners stay in place. On second to die, the 2, on third to die, the 1, and he or she will need to do planning, or their estate will need to worry about probate. So from a legal perspective, the mechanisms embedded in the US laws allow it. But now we're entering the tax segment of the issues. Up until now, we just spoke about ownership. Now let's look about tax consequences. Let's use a simple example, common example. Husband and wife purchased a property in 2010 in the height of the US real estate crisis for, let's say, $200,000. And at that time, the Canadian dollar was at par. Now, fast forward to 2021, that same property is worth $400,000, and the Canadian US dollar exchange is now at 30%. So your $200,000 at purchase was 200 Canadian and 200 US. And today, 2021, your 200,000 is really worth 400,000, and the exchange rate makes it worth $520,000 Canadian. So what happens? By adding your kids onto title, from a US perspective, mom and dad are effectively making a gift. And in the US, when non-residents make a gift, save for a $15,000 exemption on the value of the gift, the rest of the gift is going to be taxed at rates, a gift tax rate between 18 and 40%. So when mom and dad make a $200,000 gift and they each get a $30,000 exemption to 2 kids, we still have $140,000 of gift. And even if we call it 20% tax rate, although I think the rate will be 40%, let's just call it 20%, that's $28,000 of US gift tax. From a Canadian perspective now, Canadians can gift as many dollars and as much assets as they want to their kids on a tax-free basis. However, the asset that is being gifted could itself be subject to a deemed disposition, to a reputed sale, which triggers on the asset capital gains. Now, for most Canadians, the US property is typically a secondary property and not their primary residence. And so by gifting the property over to their kids, from a Canadian perspective, although there's no gift tax, there is capital gain tax. And so what happens is by taking a property that you acquired for $200,000 and now is worth $520,000 Canadian, and you're gifting half of it, that's $260,000 Canadian at, call it 25%, we're talking of an excess of $70,000. And so what do we have? We have on one hand, 28,000 US gift tax. On the other hand, we have almost 70,000 Canadian capital gain tax. Now, Canada and the US are armed with a wonderful treaty between the two countries that avoids double taxation, provided that both systems match. We have a match on the type of tax, we have a match in the taxpayer, and we have a match in the tax year. And in this example, what we have is a mismatch because we have capital gains in Canada and gift tax on the US. And when you put it together, we have an excess of over $100,000 of capital gains and gift tax, only because somebody gave us some free advice that will help us avoid probate. And if we recall, probate was only going to cost $10,000 to $15,000. Cheap advice is all the time the advice that ends up costing the most money for everybody. And we want to make sure that people, if they already own, they don't fall into a trap. If they're looking to buy, they can buy fresh. Of course, the whole issue of having your kids onto title, their creditors seizing your assets is also a problem, but that's a risk that parents are sometimes willing to take, but the tax liability is pretty big. And I'm going to say one last thing about this topic. Why are Americans, lawyers and tax attorneys, recommending this type of advice to Canadians? And the reason being is that on the US side, for American citizens and American tax residents, there's a lifetime gift tax exemption currently at 11.7 million, where Canadians only get 15,000 exemption. So Americans don't necessarily make the difference. Next slide, please. So quickly, what is the solution? I'm going to share with you one simple solution. It's one of many. It's called a cross-border trust. If you're buying, you want to buy into that, provided you're comfortable with the way it works. If you already own, you can roll over into that trust without triggering any disposition. And what's great about a trust is trusts have trustees and they have beneficiaries. And as long as there's one acting trustee in place, even though somebody's become incapacitated or somebody passed away, the trust continues to operate and it gets going. Okay. What's great about it also is that it preserves those famous foreign tax credits I just discussed on the treaty. And it protects your beneficiaries if they were to inherit rather than be named. It protects your beneficiaries from divorcing spouses and creditors. Next slide. Corporations are popular, but corporations are prone to be higher tax jurisdictions, and they also have a nasty rule for Canadians. So unless your money is in a corporation and you're looking to buy in a corporation, we stay away from them, because Canada has a special tax that says where a company is owned by an individual, the company buys the building, but the individual utilizes the services and the assets of the business. There's a taxable shareholder benefit rule in Canada that causes the Canadian person to pay tax on the enjoyment of the asset belonging to the corporation. And I'm going to say this: anybody that wants to buy property in the US and is receiving advice to buy it under an LLC, please refrain from doing so. Do not buy through LLCs. They're going to get complicated. It's going to cost a lot of money, just like we're going to see on the next slide, please. So right here, what we have is a quick summary of capital gains rates, and you'll look that trusts are very favorable, 15 to 20%. Limited partnerships are favorable, 15 to 20%. Personally is also favorable, 15 to 20%. But as we get to corporations, you're seeing that we're getting into the 25 and 30% range. And plus the money sits in a corporation. So if the individual wants to pull it out, they got to declare dividends. And look at LLCs. LLCs, that's the famous double taxation. Every dollar will be taxed at 46%. And that's before being taxed in Canada as an extraction of dividend. LLCs could typically cost you anywhere between 75 and 85% tax on every dollar. So whatever you do not purchase or invest into real estate directly through a US LLC. Next slide, please. So we'll go quickly through these. During the term of the last 2 years, a lot of Canadians chose to sell the property because of the restrictions. Obviously always speak to an expert on taxes on both sides of the border, but you need to know that you absolutely must have a tax ID number. You absolutely must report income on the US and American side and Canadian side. You got to declare capital gains on both sides of the border. Next slide, please. You have to worry about the famous FIRPTA withholding of 15%. And here, need to know that not facing the FIRPTA withholding because you sold a property for less than the $300,000 exemption doesn't exclude you or preclude you from having to file US and Canadian tax returns showing the disposition. So you absolutely, even if you avoid the withholding, you absolutely have to pay and file for tax returns. Next slide, please. Okay, this is a nice slide that works well for the bankers. And I would say that anybody that owns a place that has seen his property go up in value and feels that he may want to refinance rather than selling and renting, they should give us a call. We'd be happy to take you through the process and work with you and your banker with respect to how these things work and get you where you need to be. Next slide, please. US estate tax for Canadians is a real thing. Although we are not Americans, we are still subject to the rules of the land. And so if Canadians pass away with assets greater than $60,000, next slide, please. I want to get to the next slide. If they pass away with assets situated in the US of more than 60,000 and their worldwide assets, wherever they are situated, are worth more than 11.7 million today, 12.1 million as of January 1st, 2022, there will be US estate tax. Good news is only on the US situated asset. So if we go to the next slide, you'll see your $100,000 taxable property in the US over a $1 million worldwide estate value will get you zero tax. But if you go to the next slide, you'll see that a $950,000 home with a $20 million worldwide will get you some tax on the US side. So it's an easy calculation to make. On our website at levysalas.com, there is a calculator where you can plug the values of your property, the values of your estate, and it will tell you whether or not you are subject to US estate tax liability. And next slide, please. The one after that, please. Right. So let's get into the very interesting, probably the most interesting part for most participants today in this presentation is how many days can a Canadian spend in the US? And the answer has got two facets. There's an immigration question and there's a tax question. For an immigration perspective, the Canadians that cross the border get what we call a verbal I-94, which basically provides them with a stay permission for 6 months, 180 days, over a 365-day cycle. What does it mean? It means that if you enter the US January 1st, well, you've got 6 months until the following December 31st. And so if you go and you walk into the US and they put a stamp in your passport, you've got pretty much 6 months to stay. which means that if you stayed for full 6 months, you can go back before January 1st of the following year. A lot of our Canadian clients, Snowbirds, will go October, November, December 1st, and so they'll be able to stay till April, May, or June 1st, or maybe March, May, and March, April, and May 1st. Okay, and that's the immigration piece. Do not overstay. Do not use COVID as an excuse. I just dealt with a situation where one of our clients couldn't leave because they were waiting for their second vaccine. There was very little flights during COVID. They just re-entered and the woman got barred. She was held in a cell for 14 hours and put on the next flight back to Canada. So we have to be extremely careful. The immigration is no joke. And you definitely don't want to find yourself out of status in the US. Next slide, please. So that what happens if you find out that you may overstay or you think that you may want to do, I believe that we put in an article in the Snowbird Advisors magazine where we speak about a scenario where people want to stay a little bit longer, and it's by them applying for Form I-539. And basically, as long as you're on status, as long as you're within your visa, your 180, you can apply for an extension to that visa with Form I-539. It's a complicated visa. You need biometrics, you need fingerprints, you need certificate of good standing from police, corps. But at the end of the day, if you start that process and then have to overstay, you'll be protected and you won't get barred. Even though it takes 6 months, sometimes 8 months for that approval to come in, if you left after 2 months, you were still within status. So we want to make sure that you absolutely go through the process if you want to stay. But in theory, as Canadians, we need to get out of the US because the visa expires. We need to get back to Canada because most provinces are going to impose a certain limit of months you can be out of the country before you lose your health care. We want to make sure we don't get caught in a situation where we own a home, but now we're barred from the US. So I think we're going to skip a couple of slides here. One more, right? It's very also important to know that you need to go through the approval process. It does not happen automatically. You may get rejected and then you have to leave the country. So if you're ever in that situation, make sure you speak to a professional. You're free to call us and we'll be able to guide you. The next slide speaks about the tax scenario and how many days are we allowed to stay in the US for tax purposes. Now, unfortunately, where the immigration is a straight out calculation over a 365-day cycle, here it's a calendar cycle, a calendar year. You can't stay in the US for more than 182 days. However, the US came with a trick and they created the substantial presence test, which is a test based on a formula where you utilize or you count 100% of the days of the current year, taxation year, 1/3 of the days 1 year prior, and 1/6 of the days 2 years prior. And you put all that into a blender, and if that number that pops out on the calculation is greater than 182 days, guess what? The US will consider you a US tax resident. So I'll give you a very famous example. Snowbirds that typically spend year after year, 180 days. See, in a calendar year, 180 days is still under 182 days. Yet when you put in the substantial presence test, and we use the formula of 180 for current year, and then 1/3 of 180 for last year is 60, that's 240. And 1/6 of 180 2 years prior is 30, that's 270 days. So based on the substantial presence test, anybody that stays year in and year out, 180 days in the US is going to be deemed to be a US tax resident. Therefore, the US created Form 8840, the closer connection form, and it allows people like ourselves to tell the US, although based on your formula, I'm here 270, physically I did not spend more than 180 days per year, and therefore I'd like to be considered a taxpayer of Canada. Okay, next slide, please. So if you want to do absolutely nothing and want to stay away from having to file Form 8840, the magic number for you to stay is 120 days every year. Why? Because when you do the math on the formula, 120 days every year gets you to 180 days, and that's below the 182 threshold. Now, if for some reason you end up staying more than 182 days physically in the US, now you've got an immigration problem, but you also have a tax problem, because automatically you'll be deemed a US taxpayer unless you deal with your accountant and they take treaty-based position, the Canada-US treaty positions, to demonstrate that no matter what, you're going to remain a Canadian taxpayer. So remember, two concepts: one's immigration, one is taxation. We don't want you to become US taxpayers, because then it means having to report and pay taxes on your worldwide assets to the US as well as to Canada. And since the tax system have a bunch of mismatches, we have to be careful, because you could face double taxation. Here again, if you go to the next slide, you'll see on our website at Levi Salis, the one after that, there's also a calculator that shows you how to fill in your days for the tax years. We're still haven't finished 2021. So as of January 1st, our calculator will show 2021, 2020, and 2019. You put in the number of years per days per year, and the system will tell you whether or not you need to file a Form 8840, a closer connection form. Now, one last piece of advice: if you are filing a closer connection form and you're sending it to the IRS and you do not hear from the IRS, guess what? No news from the IRS is good news. Don't call the IRS, don't chase them, don't ask them, hey, what's going on with my form? If they're not speaking to you, it's good news. So typically these forms go into a big black hole and nobody raises any issues with them. But in the event that they're calling you, be prepared. Otherwise, do not reach out to the IRS to find out where we stand. Last slide, please. So based on everything you've heard and based on our expertise in the introduction, our process is very simple. We have Canadian and US attorneys, we have Canadian and US offices, and that allows us to not only analyze and recommend solutions or give you advice on your personal solution, but we can also implement some of these strategies should they become necessary and available. And thanks to our fantastic partnership today, then we are very happy to provide every person that feels the need to ask questions with a courtesy consultation. They can call our offices at the number below or write us an email from the website, ask for a consultation request, and one of our attorneys will be pleased to provide you with the personalized touch and advice on a completely courtesy basis. There will be no fees. If there's any work that's necessary, we'll be happy to provide you with a quote. And if you're happy to work with us, we'll be thrilled to work with you. So without further ado, I'll send this back to Vanessa. I want to thank you all for the opportunity and your patience in listening to me speak this afternoon. Thank you.
Thank you so much, Shlomi. That was actually really interesting, which is not something I often say about taxes, but I didn't know a lot of that. So it was, yeah, very interesting and good to keep in mind. We do have a few minutes here. I mean, we don't have a lot of time, but I will give everyone a few minutes if you have specific questions that you'd like to ask. And again, if perhaps you're not comfortable or you don't want them brought up in public, feel free to send us an email at info@seniorsactionquebec.ca, and we'll pass them along to whichever speaker you want to talk to. There were a couple of questions from the earlier presentation for Stephen, if he's still around. I don't know.
I'm here.
Okay, so somebody wrote in and asked a question. You were talking about prescription drugs, and the question came up about medicinal marijuana and the US. If you have a prescription for medicinal marijuana and you're going to the United States, what do you do?
No, no is the answer. Don't do it. You're still, I mean, marijuana is decriminalized in some individual states, but at the federal level, it is still a criminal offense. If you have medical marijuana or even cannabis products here, just to err on the side of safety, even if there's no, even if there's no THC in the product, don't take it across the border. Don't risk it. It's not worth it. the laws are very different, and you could run into a big issue, and you could be kicked out and barred from the US and face criminal charges potentially even.
Remember that the entry point to the US is a federal jurisdiction. So the border is a federal jurisdiction which hasn't decriminalized the cannabis industry yet. So absolutely stay away. Absolutely.
Yeah, even with a prescription, people should not assume that that's any kind of pass.
They won't recognize it in the US, so don't do it.
Okay. I hope everyone heard that. Everyone, don't do it. Don't do it. And then Stephen, one quick question. I don't know if you have this information to hand, but somebody was wondering about the rules to travel in the Caribbean, if they're similar to the US or Mexico.
Every country has their own rules, and the big issue is, you know, we on our website, we actually have an article. You can go and look on our website. It should be on the homepage. We published a couple months ago that did an overview of popular snowbird destinations that includes some Central American and Caribbean destinations. The issue is there's so many different destinations, and the rules change all the time. And as we've seen as case counts go up, there may be more restrictions. They may have lesser restrictions as case counts go down and more people are vaccinated. So it changes all the time, and it's impossible for us to keep track of every destination. So really what you want to do is check with those individual destinations and see what their requirements are for international travelers. And some of them may have specific ones for certain countries like Canada, but a lot of times they're for international travelers. So you're going to want to check and see what the latest rules are. And the other thing is, if you're not going immediately, you're going to want to keep checking those rules until you actually depart, because they can change at any time without notice in the current environment. So you're going to want to be careful. We track the US and we track Mexico mostly because over 90% of snowbirds go to those two countries.
Okay. So somebody has sent me a little note asking if there could be some explanation or clarification on I-94.
I think Shlomi's in the best position to handle that.
Yeah, I was about to say, I think that one's for Shlomi.
I'm not sure what the question is, but maybe I'll just go on a small rant on I-94s. Okay?
Probably a good idea.
Every person that enters the US gets granted access or visa to the US. If you were a UK resident or French national or German national, when you enter the US, they give you a little card. They put a little visa. It's called an I-94. And on that, they stamp the number of days you're allowed to stay in the US, okay? Typically, depending on the treaty countries and depending on the relationship, some countries would be allowed to stay in the US for 4 months, some are 90 days. Canada is one of the only country, I believe, that allows you to stay 6 months. And because of the reciprocity between the two countries, we don't need to apply for any waivers of entries. We don't need to apply for visas. So the physical action of providing somebody with a physical I-94 doesn't exist. So Canadians are known to receive what we call a verbal I-94. Welcome to the United States. And if nobody stamps your passport, you're in automatically for the 6 months. So the difficulty is that a lot of people speak about how many days you can stay in the US and what happens if you leave and come back, and does it affect your number of days and so on and so forth, because of certain clear-cut instructions on the back of a physical I-94. But none of this applies. I can tell you that the Snowbird magazine or Snowbird Association magazine, which has nothing to do with the Snowbird Advisor,
thank you for clarifying that.
Yeah. Many years ago, issued a statement that if a snowbird, for instance, went down south December 1st, chose to come back to Canada between the 24th and the 5th, which is give or take 10 or 11 days, and went back to the US, then those days that he was present in Canada don't get excluded from his calculation. And the reason being is that they were taking information from the back of a 994 physically. I could tell you without a shadow of a doubt that if you enter the US today and left it tomorrow, well, you may be subject to counting 2 days, one for today, one for the day of departure. But any day you spend outside of the US will not count towards your 180. So it's tricky, but I-94, briefly described, is a little piece of paper, which is your visa into the US. and because of the reciprocity, we get a verbal one. You may get a stamp in your passport more and more today because they want to give you the date of your entry. But other than that, there isn't much to it.
And Shlomi, I think, let me just to add on to that and correct me if I'm wrong on this front. Where some Canadians run into trouble on that issue is that the actual CBP officers are sometimes misinformed about what the policies are with respect to Canadians. So they will give you the wrong treatment based on rules that other travelers who are subject to other I-94 restrictions are subject to, and they will wrongly apply them to Canadians. And then you have a problem where you need to get that fixed after the fact. Is that correct?
You typically find those problems where Canadians don't clear customs on Canadian soil, right? So if you're going to fly out of Toronto or Montreal, no problem. But if you leave and clear customs once you've entered the US, where the where the cross-border or officer is fielding entrants from Europe and from Africa and from Asia and from Canada at the same time, they are often going to misinterpret the law and cause a lot of aggravation. Nothing that can't be fixed if you pick up on it. The advice that I give my clients is do not haggle with them, don't argue with them. For that single minute where you're in front of him, he's president of the world and you're just a subject. So everything could be looked into, it could be fixed, but if you, as Stephen said, if you get into trouble, if you get barred, the mountain is so high to climb to get back in there. And not only once you come in there, like that client I was telling you about that got barred, the only way for her to go back to the US is with a waiver now, pretty much reserved for people with criminal records. And I can guarantee you that for the rest of her life, if she flies or she goes across the border, she better get there 5 or 6 hours before, because she's always going to the back. She's always dealing with secondary investigations on her entrance to the US. It ain't going to be pretty. So for that minute, be respectful, be tolerant, be humble, let them do their job. Whatever doesn't go the right way could always be affected. But if you get on a high horse and they try to ram into you, it never works well for the citizen, for the client.
Yeah. So I've just had someone ask for a clarification. If we go to the US for a few days and then a few months later we go over again, we add these visits together towards our total of 180?
That's correct. That's correct. Exactly.
Yeah, that's what I understood as well. And then last one, I had a friend whose husband passed away suddenly in Florida and the wife had a really difficult time. Are there any tips or procedures they should have had in place? They already had excellent insurance, and money was not an issue. So
yeah, that was the essence of the presentation. I mean, sorry, Stephen, go ahead. But
sorry, was that related to their property that they owned, or just in general they had a rough time while they were in the US?
It isn't clear. I assume, I don't know.
Well,
if it's property related, obviously, Shlomi, that would be in your court.
Well, I'll just say this. Losing somebody dear to us is never easy, and it doesn't matter where they pass away. Being caught with an uncomfortable situation as a death or an illness in a foreign country, definitely a problem. I believe I heard you, Vanessa, say that they were properly covered insurance-wise.
Yeah, so, it sounds like she just had a difficult time getting him home, like just in general, getting back.
There's issues. There's all kinds of issues. It's a different jurisdiction. You know, autopsies, unfortunately, if there's a suspected death, will take much longer there. Getting everybody or anybody to recognize issues on the Canadian side is also a difficult process. If they had issues and if that person had issues with the property, as Stephen suggested, then I think that the essence of the presentation speaks for itself. Sometimes people become sick, they become incapacitated, they go into a vegetative state, or or their clinical death, and we can't make decisions for them. Having the right paperwork in place will definitely go a long way in terms of life prolonging procedures, or pulling the plug, as we like to use the term, or, just even being flown back home if the patient can't consent to treatment could be a big issue. Insurance companies, as most of you know, like to collect premiums, but it's very difficult to make them pay expenses. So they typically like to, not deal with the big expense. So they'll want to fly the patient back home. But if they don't have consent, it becomes difficult. So there's enough information in the presentation about the incapacity side, the debt side. If the client has more specific questions or wishes to discuss with me or with Stephen, then I think we'll both make ourselves available without a problem. Speaking for you, Stephen, but I know how available you make yourself. So, and yeah, I mean, it's not easy. It's not easy losing somebody, let alone in a foreign country, let alone after they've suffered some illnesses or some pains and suffering. So, but our objective is to try to guide and ease that pain where possible, or prevent it altogether if possible.
Great, thank you. All right, I appreciate everybody for your interest. If a question does come to mind after this, again, feel free to send us something in email. I'm just going to put our email in the chat box, if I can spell properly. I'll write it after I'm done talking. And I want to take a moment to thank our speakers, Stephen and Shlomi and Jason, who has already left. I think you provided excellent information and insight. For everyone who's concerned about not having caught everything, we are going to be sharing this presentation, the recording, the presentations. All of our speakers have websites with more detailed information. I encourage you to keep an eye on them. Anyone who's thinking about traveling, I encourage you to think about it, keep an eye open. Hopefully in coming weeks, things will become easier again. But there are a lot of websites out there with information to help you. So thank you everybody for the excellent information. Thank you to Ruth Peltier for putting everything together for us, and all of you who took the time to attend. It's very appreciated. Oh, Katia, thank you. Our email is up there, info@seniorsactionquebec.ca.
And thank you, Vanessa, and thank you, Ruth, for having us. We really appreciate it, and we hope the information was helpful. And thank you all for joining us today as well.
Absolutely.
Thank you very much. Thank you.
That's marvelous.
Thanks, everybody.
Excellent. Thank you very much.
Cheers.
Bye.